Some of you have heard of bursitis or whatever. Okay, you have a lot of bursa. It helps reduces friction located between the skin and muscle. So where there's a lot of movements, there's usually a bursa there to reduce friction. Okay, see, you have another bursa here. Okay, another bursa here. Types of synovial joints classified by the shape, okay, of the adjoining articular surface. These are the different types of synovial joints. Okay, and we need to know all of them, and they are all in the lab and in the test as well. Okay, easiest one is the ball and socket. Okay, ball and socket. Okay, there's let's see. Yeah, we're gonna look through all of them. So anyway, there are 6 of them: plane and glide, saddle, hinge, pivot, ball and socket, condylar. Okay, let's look at all of them. Ball and socket. Okay, it's got good mobility. Okay, many plane, coxa, and the femur, scapula, and humor. So of course this joint is not, but this joint is. Okay, so this is the coxa and the femur head. Okay, that's a ball and socket in the shoulder. Okay, condyloid. Okay, ellipsoid, elongated ball and socket, shape limited range of motion only to 2 plane in your metacarpal, metatarsal, and phalanges. Okay, only two movements. Plane and glide, 2 opposite flat surface, gliding and twisting movement. It's got your facet between the vertebrae. This one, can't see the facet, but in the vertebrae, it's got your joints and wrists and ankles. Okay, these are all kind of straight. Okay, gliding. Pivot joint, it rotates around a single in your atlas and axis. So this is your atlas. Atlas, the first bone. Axis is the second bone. So this bone right here rotate on this guy. Okay, on the dens of the axis. So it moves left and right. This is how you get your neck rotation. Okay, also in your radius and ulnar. So that's your plane and that's your pivot. And then you got your hinge joint. Hinge joint is also easy. Just one direction, up and down. Okay, flex and extend like a door. You know, it's got a hinge there. That would be the hinge joint. Elbow, knee, finger joints, ankle. Saddle joint. Saddle is like a horse. You know, the horse saddle when you sit in. Okay, one is concave, one is convex. Okay, remember some of these. Some metacarpal of the thumb, between the sternum and the clavicle. That's also a saddle joint. Types of movements. Due to the muscle attachment to the immobile site. So in chapter 10, you're going to learn some of the muscle origin and insertion. Insertion is where the movable part, so the insertion will move toward the origin as the muscle contract. Okay, it's going to move from the insertion to the origin. So it depends on the muscle movement. Describe relative to anatomical position, accompanied by movement of the opposite direction. Okay. These are some movements, okay? Flexion, extension. Flexion means bringing closer. Extension is going backward. So flexion usually going anterior and extension going posterior. So flexion is, for example, let's say your neck, flexion is looking down and extension is looking up. The arm, same thing. Flexion is going this way, extension going that way. The knee, flexion is this way, extension is that way. So we just have to practice a lot. Okay. The body, the trunk can also flex going forward, extend going backward. Okay. There is abduction and adduction. AB going up and AD going in. And then there's rotation, internal, external rotation, medial, lateral. Yeah, this is the abduction. Okay, abduct is away from the body, away from the midline. Okay, like an alien abducting you. Abduct. Adduct, coming toward the body, Circumduction, encircle. And we have rotation. Okay, again, lateral rotation going outside, medial rotation going inward. And that's just a general rotation. So this also, please remember, okay, also in the test, plantar flexion is when you point, your toes going this way. Dorsiflexion is going upward. Okay, dorsiflexion, plantar flexion. Okay, eversion is going out, inversion is going in. Okay, so a lot of time we sprain our ankles, in the inversion motion. Okay, inversion, eversion. Okay, let's see. Scapular movements. Okay, anterior gliding, protraction, and retraction is posterior gliding. Okay, elevation going up, depression is going down. Pronation is turning your wrist down where you can see the back. Supination is turning the hand up where you can see the palm. Okay, so this is supination, palm up, pronation, palm down. I guess that makes it easier. Example of synovial joints, vertebral column, temporomandibular joint, which is in your jaw. Okay, shoulder, elbow, hip, knee, ankle, and foot. Okay, let's look at the vertebrae. Vertebral column. Between the body is what kind of joint? Do you guys remember? Amphiarthrotic joint. Very little movements. Okay, little bit of movements. Okay, so here's the facet. Facets are in between the superior vertebrae and the inferior vertebrae. In the cervical, here's the atlas, the first bone. Okay, here is the second bone, C2. This is how it rotates left and right. Remember we saw that? In the cervical, it's flattened horizontal, so you get more flexion and extension and rotation. In the thoracic, it's more flattened and vertical, so you have limited flexion and extension, but allows rotation. In the lumbar, you have very little rotation, but lots of flexion and extension. So it depends on the joint that gives it its mobility. Here, the temporomandibular joint. Okay, some of you have heard of TMJ. Okay, when you have a TMJ problem where the joint slips out because of the disc, it's out of location. Okay, You can elevate, depress, protract, retract, and excursion. They're both gliding and hinge joint. You can open and close your mouth. So when there's a dislocation, it's when the condyle is moved out of the place. Shoulder joint, called the glenohumeral joint, humeral joint. Okay, the largest. This is the one with the largest range of motion, but it's offset with stability. Okay, again, we've seen some of these bursas. Okay, bursas again is in between skin and bone, so limit friction. Got a ball and socket joint. Got all kinds of motion in there, right? Some of the ligaments we need to learn for the test. It is in orange. Okay. So let's remember some of the anatomy first of the bone. Okay. Remember, there's a C joint. This is the A, which stands for acromion, clavicle, and then the one sticking out in the front is the coracoid. Okay. So this is the coracohumeral